This one is called Tom and Jerry. We did this in our first Fiddle Club concert.
Emily Luna is 12 years old and learning to play violin, but she's most inspired by fiddling. What's special about this performance is that she just had a very painful bone marrow biopsy procedure and has just come to from anesthesia.
It was a particularly rough biopsy, and she's, you know, I mean, obviously she's medicated for it and that kind of stuff, but she was still relatively unconscious from the propofol, and she's laying there, and I said, you know, it's okay, honey, you know, we can try to do the concert later. And she just, like, eyes opened up, she pops up, she goes, oh, the concert, I gotta get ready for the concert. And I'm like, okay, slow down.
The other aspect that's unusual about this particular performance is the venue. The Outpatient Treatment Center Playroom at Golisano Children's Hospital. Here, there are children of all ages getting treatment for diseases ranging from cancer to aplastic anemia, which is what Emily was diagnosed with 3 years ago.
The bone marrow is the substance inside the bone that creates blood cells. My bone marrow is not doing that to the level it is supposed to be doing. The nurses and child life specialists and docs, they make it a lot more fun to be here, but a hospital room is not always the place you want to be. I kind of try to make it a little bit more fun.
Music has the ability to block pain for patients sometimes, and so if they can actively engage in music, whether it's singing, whether it's playing an instrument, it can actually help to make the experience of pain lessen and maybe even not be experienced in the moment that they're doing their music, and so it becomes a powerful distraction for them.
I think she finds some relief and some solace in her music. So she just started bringing it, just like, well, I know these little kids will like these tunes, nursery rhyme tunes. And then more and more, she'd be like walking back to her room and, you know, some little kid would come out and be like, you're the music girl. Then it just sort of became a tradition. Every time we come here for treatments or transfusions or whatever, she's got the violin in tow.
Bringing their instrument in and just knowing that they have something they know they're going to do while they're there. It gives them a sense of control and a sense of empowerment over the environment.
She's a very loving, nurturing kid. She wants to pick people up if they're down, and that's always been her style. The fact that she's brought music into it is just another avenue for her to be that way.
So not only would it help the child who's performing, but it can also give the other kids something else to think about and focus on, maybe even inspire them, and just kind of build the morale of the room that they're in, you know, just changing the environment and making it more positive.
I really don't know what it does for all the other kids, but what I try to have it do is kind of make it something they can look forward to, kind of brighten their day a little bit.
Heather Hare, Golisano Children's Hospital at the University of Rochester Medical Center.